We're continuing to focus on finding solutions to the opioid epidemic. One question stands out. What if addiction could be prevented before a patient took any doses of painkillers? WMAR2 News' Mark Roper found a researcher who is looking into that part of the issue. Good morning, Mark.
Good morning, Chris. You know, we were wondering, why would doctors prescribe a drug that's already known to create a dependence on it for some or deadly for others? And so we found one doctor here at Johns Hopkins Medicine who's leading research to see if it's possible to predict addiction.
Relax.
One day, doctors may be able to predict your chances for developing addiction just as they currently do for high blood pressure, diabetes, or other genetic traits.
We think there may be a genetic link to that different response, and that if we can identify, if we could trace it back to a specific gene, then we could maybe predict that better in the future.
Here at Johns Hopkins Medicine, Associate Professor of Psychology and Behavioral Sciences, Dr. Kelly Dunn, is leading a team that's researching if it's possible to determine who's predisposed to have positive or negative reactions to taking opioids.
If we know that we have to prescribe opiates for pain management, we want to be able to do that while still reducing the likelihood that they develop addiction. So personalized medicine, or understanding kind of the individual risk factors, is a new method that we're starting to use that can help us do that.
Yet doctors have known for years some patients develop a dependence on opioids. So why hasn't the medical community done more studies like this?
There's very few places that have the opportunity to do these types of studies. So we have the resources to do laboratory studies where we can actually model situations related to drug use disorder and use that to predict whether or not somebody might find them addictive.
Before doctors write any prescription, they usually ask their patients if they might have an allergic reaction to certain drugs. The goal at Johns Hopkins Medicine is one day patients may be able to answer regarding addiction.
So what we're hoping is that we can inform the field and inform providers and individuals who are taking pain medications of the risk factors or the risk profiles that exist and how to better target them so that people can minimize the likelihood that they would become addicted.
And in the future, powerful painkillers might not be off limits for those predisposed for addiction. Next hour, we'll talk with a doctor who's working on a non-addictive opioid-type drug. We're live in East Baltimore. Mark Roper, WMAR2 News.
Okay.